Let's set up the Sony A7C2 with the 100mm macro lens, Godox MF12 flashes, Godox XPro 2S trigger. You can, as an alternative, also use the 90mm macro lens. But if you decide to use a full frame camera like the A7C2, I would today recommend using the 100mm macro lens and also add the 1.4 time teleconverter. So this gives you 140mm of working distance. So you feel not too close to your patient. You have the space to adjust the settings, and you see an additional tool that I recommend is also using a flash bracket to get the lateral and ring flash in one compact setup, and you don't need to buy an additional ring flash like the MFR76 that we see here. We will talk about this later. Before we jump into some tips and tricks, let me share how to set up your camera. Let's check the menu and then get back to tips and tricks. Now we have set up the camera correctly. You have saved intraoral photography on the dial number 1, the extraoral, the portrait photography on dial number 2. If we talk about portrait photography, I have a dedicated video just on this whole thing. But now let's focus on get into dental photography. So the camera is set up correctly. You turn on the camera, you turn on your flashes, the trigger is on. As mentioned, with the XPro 2, you can go for dental mode. What I recommend first is hold your camera with your left arm. So the left hand is the tripod, the elbow is here. So I'm in a stable position. In the past, I used the viewfinder. Now I'm not using the viewfinder anymore because in these compact cameras, it's on one side and it was like interfering with the axis of the lens. So I prefer to use just my back screen with focus peaking. So you hold the camera, the patient sits in front of me, and I'm also able to connect visually with my patient. And then I just can pre-focus. You can use the numbers on your lens to pre-focus for smile 1 to 3, or if you want to get closer, you get more on the 1:1 magnification. The more you go on the right side, the further away you are. And then you just frame the shot. If you see that the focus peaking gets red is the color I recommend, then you just push the button and you have the result image preview turned on that I immediately see what I have shot. So this is the number one thing. And then just by using the framing, you see what you want. Many of you then ask, is this enough? Do I need any diffusers or soft boxes? Okay, I have two, or let's say more options. Then I have a dedicated video, but to make it short, in some situations where positioning the flashes don't help me to reduce or eliminate the reflection, you can go either for this magnetic diffusers by Intra photo, or you can click on the easy to mount soft diffusers by Godox. So these are options. You can also go for bouncers, but this is a separate video where I'm talking about the use of soft boxes and bouncers. But because in most situations, just managing the light position gives you clinical outstanding results. So basically, this is what you need. And in addition, one thing that we need to talk about are cross-polarizing filters. So there are options of having cross-polarizing filters that you need for color reproduction, round ones that go on the MF-R76 flash. You click them in, or there are also versions for your MF12, both by Pro Dental Photo or Intra Photos. But this is a topic of a separate video where we talk about cross-polarization, shade taking, and all this stuff. So first of all, manage your settings, save your settings. So in the morning, you just turn your camera on, pre-focus, shoot, and I'm sure you will be happy with the results. So this is it for the short intro on how to set up your Sony a7C II with macro lens and flash. Stay tuned for our next episode where we go into more details, accessories, cheek retractors, and everything in addition you need to manage or to master your dental photography. Stay tuned and may the light be with you. Voila.